At a time when conversations around mental health are on the rise worldwide and people are recognizing the importance of treating mental health issues, UK scientists have now discovered a drug in mushrooms, or magic mushrooms as they call it. It is useful to uplift moods of patients and help treat severe depression. More details in this next report.
Psychedelics are a class of drugs that cause changes in perception, mood and cognitive processes are known to be effective in treating mental health problems. However, lack of evidence had prompted the misuse of this drug. A naturally occurring psychedelic called psilocybin is produced in more than 200 species of fungi. This drug is found in magic mushrooms. Recently, a new experiment discovered that this mushroom variant can help treat patients suffering from mental health issues. fMRI scans of 60 subjects were assessed over 2 trials. In the first trial, all participants were administered psilocybin, and in the second, the subjects were divided into 2 groups. The first group were given psilocybin and the second had the tried and tested antidepressant tablets. Additionally, all the patients received psychotherapy. The results suggest that these mushrooms are more effective in treating depression. The study is now published in the journal Nature Medicine. One of the authors of the study describes a depressed human brain as a landscape with deep valleys and mountains. There is rigidity of thoughts, he says. This mushroom drug is helping to flatten the rough landscape, thereby enabling our minds to think freely.
You look at a landscape of hills and valleys, the valleys seem very deep in depression and people get locked into the valley thinking. Now, psychedelics flatten that landscape. They disrupt the tramline thinking. And afterwards, and this is the important thing about our study, this is the first time people have looked to see what happens afterwards. And it seems that breaking down of the thinking, rutted thinking, the flattening of the landscape persists after when people get well. And that is, we call increased flexibility. Their brain can work more fluidly, they can switch between thoughts and processes more easily. And we think that underpins the benefit of psilocybin and probably other psychedelics in depression.
Not only is the mushroom drug working effectively, but it is also treating those who showed no change after using antidepressants.
They work in a different fashion, they work in a different part of the brain, and they often work when other treatments haven't worked. In our first study, all the patients we treated had failed on at least 2, some had failed on 10 antidepressants.
After the success of this experiment, mental health experts are hoping to start drug trial on patients suffering from eating disorder. Bureau Report, WION World is One.
WION World is One is now available in your country. Download the app now and get all the news updates on the move.